Hello and welcome to A Healthy State, a series where I talk to doctors and other health professionals about important health topics. I'm Dr. Nelu Simmons, thank you for joining me. Today we will be discussing the health and well-being of the elderly and ageing population. Roughly 16% of Australians are aged over 65 years old, and this is increasing. The leading disease in this age group is heart disease. Other conditions include dementia, lung disease and stroke. It is crucial that those aged above 65 take care of their health, but most importantly, work towards preventing disease as early as possible. In today's episode, we will talk about the importance of having a regular GP, preventative measures, lifestyle tips, and mental health in the elderly. Now I'm delighted to be joined by General Practitioner Dr. Andrew Gann. Dr. Gann sees a range of patients from children to the elderly. He loves working with his patients to manage their illnesses. Now today he is going to speak to us about why it is crucial that older people have a regular GP. Welcome to the studio, Dr. Gann. It is an absolute pleasure to have you here.
Thanks for having me. It's a delight to be here.
Now, I'm sure many of us know that older people in the community would see GPs a lot for medication, for management of their underlying illnesses. But is it important for older people to see a GP regularly for other reasons too?
Certainly. As a GP, I love seeing older people. I love hearing their stories. There's so much wisdom and so much experience there. As a GP, I know you might find it a bit of a bore coming to see GPs for medication scripts, for referrals, but there's so much more that we can offer you there. From looking after and managing your chronic illnesses, to helping you maintain your independence, helping you do the things that you love continuing to do. So participating in sports, playing golf, driving, meeting up with your friends, as well as preventing future illnesses. So talking about preventive tests, vaccinations, and other measures.
Oh, great. We will be talking a bit more about that later in today's show. I wanted to ask you, apart from just medical advice, is there other things that GPs can do for older members of the community?
My own parents and my in-laws are all in their 70s, and I've seen them as they've gotten older. And what I really like to do is help people live the best life in their golden years. We can help assemble a team around you that can help you maintain your independence, maintain your health and your fitness as long as possible. We can refer you to services such as My Aged Care, where you can get home help, where you might be able to get extra services or even respite care, meals on wheels and such. We can arrange for referrals to allied health practitioners like physiotherapists, podiatrists, home visiting nurses that can help support your health, support your well-being as well.
Great, so basically you cover much more than just medical illnesses by the sounds of it.
Certainly, we don't just write scripts and gives you bits of paper. We help look after other parts of your life and help you live the best life that you can.
So as a GP who sees a lot of older patients in the community, what sort of conditions do you see a lot of?
That's a good question. Things that I see most often are things that you've probably heard of: diabetes, high blood pressure, heart disease. Occasionally we see lung problems, emphysema, and occasionally cancer as well.
Are there any other conditions that people may not be aware of, or that the community might not have that much awareness about, that you see that you think it's important for our viewers to know about in the elderly population?
Certainly. There are a few things that we know are out there, and many people probably have it as a into their golden years, but may not know they have it, such as osteoporosis, so brittle bones, and dementia as well.
Okay, and so do you do a lot of prevention around these topics as well?
So I talk to people about risk factors they may have for having all these conditions. I might run some initial tests and check assessments to see if they may have these illnesses or may be at risk of these, and we put together preventive strategies if they don't have it to reduce the chance of developing them.
Okay, and I assume that we've got a range of viewers of all different ages. What sort of ages do you think someone should start seeing a GP regularly in order to prevent some of these older onset diseases?
What I always tell my patients, it's never too early to start. Talk to your GP and say, hey, I realize I'm getting older, and for some people, 60 is old, some people 80 is old, and your GP will be able to advise you what tests can be done at your age, what might be appropriate to start looking out for. As I mentioned before, lots of people out there have conditions that they may not even know about, such as diabetes or underlying heart disease. And it's best that we can catch it early so that we can treat it and help maintain your life as long as possible.
Yeah, that's exactly what I was thinking. People might be thinking, oh, I've got until I'm 80 odd to start worrying about all this, but I assume a lot of this stuff is better picked up early.
Exactly.
And so therefore starting to see a GP regularly earlier is better.
Certainly, yeah.
Yeah. And in your practice, do you find that you are able to prevent illnesses and sort of change the time course and the trajectory of people's diseases by seeing them earlier on?
Definitely. Over the last 10 years, I've been working as a general practitioner. I've talked to a lot of my regular patients about preventive tests, about changing a lifestyle, maybe changing their diet, doing a bit more exercise, being a bit more conscious about their health. And these has actually managed to prevent some illnesses or slow the onset of other illnesses as well.
Yeah. And, on the flip side, do you see patients who come to you with a lot of illnesses that are already established that you can then help tease out what's going on and help set up some management plans for them?
Certainly. What I tell my patients is there's always hope. There's always things that we can do. It's never too late. I've seen people with very late onset illnesses and diseases that we've been managed to treat and in some cases even cure. I mean, that may not be the case in every single situation, but there's always something that we can do to help treat your disease, slow down its progression, and sometimes even reverse it.
In terms of seeing more of the elderly population, what is your thought on having them come in with other family members or children, for example, just to make things a bit easier to communicate?
I think it's an excellent idea. I know as myself, as I'm getting older, sometimes I get a bit forgetful. Sometimes I need a support person with me, especially for major decisions or big events. And it's always a good idea that, especially if you're a bit nervous, to have a supporting family member. That might be an adult child, that might be a spouse, a partner, a trusted friend or neighbor, who can just be there with you, help prompt you if you get stuck, and maybe even help you remember what actually happened in consultation.
Okay. And if patients can't get to the clinic, are there other options for elderly patients to be seen by a general practitioner?
I think since the COVID pandemic, we've seen a lot of pivoting, a lot of new technology being used. In my clinic, we regularly offer phone consultations and sometimes even home visits for people who are unable to leave their house for one reason or another.
Fantastic. So is this something that most clinics would offer that patients can speak to the staff about?
Certainly.
So are there any other closing remarks you'd like to give to our viewers?
Yeah, what I always like to tell my patients is that don't be afraid of asking your GP for help. Don't be afraid of approaching your GP. We are always here for you and we want to support you as you get older.
Thank you so much, Dr. Gan. And on that note, I just wanted to make one more comment. A lot of our viewers are from different ethnic backgrounds. How important is it to be able to try and find a GP who can, say, speak your language? I know that you are quite fluent in a couple of different languages. Is that something that we should be encouraging the elderly population in particular to be seeking out?
It's an important consideration, and what I'd recommend is find somebody whom you are comfortable with and somebody you trust. For a number of people, that might be somebody who comes from a similar cultural background or speak the same language. In other cases, it might be somebody who may not speak your language, but whom you have a good rapport and relationship with.
So many words of wisdom there. Thank you so much, Dr. Gan, for spending your time today in the studio. Dr. Kavina Sivakumaran is a general practitioner who has an interest in preventative health. Given that this is such an important topic for the ageing population, Dr. Sivakumaran joins me today to speak about some of the preventative and lifestyle measures for older patients. Hi, Dr. Sivakumaran. Thank you so much for joining me today.
Oh, thank you very much for having me on the show today to discuss preventative health.
Such an important topic, and I'm so glad that this is an area of your interest. Now, before we talk about what we can do to help prevent or slow down disease, can you please summarise some of the screening tests that GPs can do for the ageing population?
Absolutely. This is part of our everyday job. And certainly the aging population is a big issue, and we love to help people manage their health going forward. So there's lots of things we can do. Blood tests is something that we often offer a lot of our patients. Simple things in the clinic, like taking your blood pressure checked, checking your urine to see if there's any leakage of protein or infection is a simple bedside test that we can do. We often send people also for bone density screening, which is really important in this age group. We discuss vaccinations, lots and lots of stuff that we can help address health in the aging population.
And what are some of the specific screening tests for men and women that we should just be keeping on our radar?
Yeah, absolutely. So with women, I'll start off with women going forward. A few important things that I always like to address in all the women coming to see me. Number one is just addressing any symptoms that they often get. And women in the aging group, we're looking at women 50s and onwards who are often suffering from menopause. So cardiovascular health or heart health, as I tell all my patients, checking your blood pressure. We like to check your bloods in the clinic, your cholesterol, your glucose or sugars, especially diabetes can be on the radar for some of our patients. And family history is very important. So often we target a lot of your screening and preventative health based on what your family history is and your risk of developing these conditions. But that's a good baseline test to start off with. Mammograms and breast screening is really important for women, and we often go up to the age of 75. And certainly cervical screening tests, or pap smears as they used to be called, is another really good test for women. Other things that are new on the radar are like bowel screening tests that we offer to a lot of our population over the age of 50. And it's a simple kit that you can get online from your local GP and helps prevent bowel cancers. Another very important tip I recommend all my patients living in Australia is, of course, skin checks. Melanoma is high on the radar here, so please get your skin checked. So those are some simple preventative health tools that we can start off with. Other things I talk about to women is vaccinations as well, which covers both men and women. For men, pretty much the same. We start off with bloods as well, blood tests, blood pressure, and for men, skin checks also are vital. Prostate health is another very important part for men's health. A lot of men have got family history, and some men have symptoms that they like to address. So that's a simple blood test that we can organize for you when you're getting all your other things like cholesterol and glucose checked, and assess your prostate. Bowel screening is another important tool as well for men.
Great, that's a fantastic summary, thank you. Just a really quick note about skin checks. Now, a lot of our viewers are of different ethnic backgrounds, potentially quite a few viewers who are darker skinned. Is skin check still important for people of darker pigmented skin, or is this more of a fair person's issue?
Well, it is often seen as a fair person's issue, but there is still a small risk of rare types of melanomas that can occur in people of pigmented skin or darker skin color. And I often say to my patients, look out for anything unusual that you have growing on nails or, soles of your feet or palms of your hands. If you have anything pigmented or concerned, please always get it checked. You probably will not need as rigorous a skin check as someone would with fairer skin types, but I still say, put on your hat and wear your sunscreen and avoid sitting in the sun in those, middle of the day hours. To always have a check of the weather as well. But it's important to be mindful about skincare.
Yeah, good. I wanted to get that point out there because I know that, us being of darker skin, sometimes it is easy to forget about those sun-related issues. So thank you.
Absolutely.
Thank you so much for that overview. Now, as a paediatrician, I'm aware of extra vaccinations for vulnerable children and how important vaccines are. You touched on before that you do speak about vaccinations to the ageing population. Are there different or additional immunisations that you do recommend for this age group, or is it the same as a younger person?
Yeah, so for this age group in particular, we do have a few extra vaccinations that we offer. I advise all my patients in my practice to get a flu vaccination annually. This is something that's available at all your local GP clinics and even pharmacies these days. The other thing is to consider COVID vaccinations, which I'm sure a lot of our colleagues will agree that it's still out there and it's important to get COVID vaccinated. So those are the two often for across the board. Any adult, but elderly populations are often more vulnerable and at risk of developing serious infections. The other things that a lot of our other populations or immigrants might not be aware of is the pneumonia vaccination, which we like to offer for patients above the age of 65. There's 2 types and there's 2 different strains, so please go on and get that. It reduces your risk of having a severe chest infection and hospitalization. And for those patients of ours over the age of 70, there's always a shingles vaccine that's available. It's government funded. And please also go ahead and get this one because it minimizes risk of complications. There are other vaccines like hepatitis A and typhoid and TB. So if you are the type who's actually traveling a lot more overseas or wherever you're from, see a local GP, because you might, despite living in Australia and being, having lived overseas for many years, your immunity can wane over time, and these vaccinations are important to consider, especially when traveling overseas.
Oh, it's a really great message. Thank you. I hope that was useful for any of the elderly population who are watching, who are keen to try and prevent as many diseases as possible. So on that note, what can we do as we're aging to be able to try and help prevent the progression of disease or the onset of disease? Do you have any tips?
Yes. So I always tell my patients, eating a well-balanced, healthy diet, watching your portion sizes is a big thing. And sometimes what you're having, your healthy fats, bad fats, all that sort of thing. Exercising, getting some exercise in every day if you can. It's important to move, and that helps, your emotional well-being, but also your physical health. And then also engaging, I suppose, mental health is something that a lot of our elderly population, especially if you speak a second language, you might not be engaging in your community, and that's so important to ensure that emotional and mental well-being as well. So get involved in any of your local groups, because that often will lead into then physical activity, getting out of the house, and helping prevent isolation as we age. Those are some basic little tips. And if you have any concerns, speak to your GP, get tested, look for things early. We can often help you with simple stuff early, and prevention is cure, as I tell my patients.
Amazing. I love it. That is a fantastic note to end on. Thank you so much for your time today, Dr. Sivakumaran. You've been a wealth of knowledge. We really appreciate you having me on the show.
Thank you so much for having me, and I hope it helps all our aging patients out there.
Oh, I'm sure it will. There are lots of really important messages there, so thank you so much. Now we will hear from Associate Professor Samantha Loy, a psychiatrist who sees and treats older adults for a range of disorders, such as depression, anxiety, and memory problems. She's going to speak to us about mental health disease in the elderly and give us a summary about dementia, one of the most common conditions in this age group. Hi, Professor Loy. Thank you so much for joining us today.
Hi, thanks very much for having me. And I was going to talk a bit about dementia, but I was also going to talk a bit about depression, which is also common in older people. So I might start with that. And just to start off with, getting older happens to everyone, and this can be quite a positive time. So you can stop working, take a break, spend more time with your family and loved ones, and do all the things that you didn't have time to do when you were busy working. So you might be wanting to travel, pick up a hobby, see your grandkids more. So that's all really good. However, getting older can also be a time of loss. So it's not always positive for everybody. And so life may not have turned out how you have planned. And so maybe you had to work, your work stopped, and so you don't have the financial means to do the things you wanted to do. Maybe you have health problems, and so you're less mobile, you're less able to do the things you've actually wanted to do. And, you might have hearing problems or not able to see or have a lot of pain. And this can really impact on the things you want to do. And hence, getting older may not be a positive thing. The other thing is that, you might have lots of time, you want to see your friends, but actually it can be quite a lonely time as well. And so it can be hard to fill your day. And so, for example, you might feel a little bit angry or irritable. You might not feel yourself, you might feel sad, and you might not be bothered to go out or even get out of bed, not even wanting to eat or do all the normal things you want to do. And even your appetite might change. And so this is actually not part of getting older. So getting older is generally very positive. So if you start to not be yourself and, feeling a bit down or even sad, it might be time to think about getting some help. And it can be really hard to ask for help. And so I know in some cultures, there is no word for depression or feeling sad. It can be quite shameful to ask for help. And people think sometimes getting depressed is the same as getting older, but it's not true. And I really urge that if you are feeling down or sad or irritable, think about speaking to someone you trust, getting some support and speaking to your GP. So just letting them know that things are not quite as they should be. And it's really important to get some support and help. And this could be many things. It might be just talking to someone. Maybe you might have to have some medication, and that's okay as well. It's really important to think about having a good life. And if you're not feeling good, try and get some help. So that's one thing I wanted to say. So one message is depression is not part of aging. And the other message, which we spoke about earlier, was about dementia. And again, yes, when you get older, you might forget a few things. You might not be as sharp as you used to be. However, dementia is also not part of aging. So being forgetful and not knowing things isn't part of getting older. Some people think it is, but it isn't. So I'm here to say that it is, it is normal to be a little bit forgetful when you get older. You might go to a room and not remember why you're there, or go to the fridge and open it up and not remember why you're there. That can be quite normal. You might be a bit slower, not as sharp as you used to be. But if you're forgetting people's names, or if you're forgetting the names of objects, so you start saying, oh, what's that word? What's that word? And really not being able to put sentences together. And if you're finding or someone's commenting that you're repeating stories and you can't remember what happened yesterday or the week before, your grandchildren's names and their birthdays, that might be an indication to start to get some help. And there's many reasons why you can be forgetful, not just because of dementia. We talked a bit about depression, and depression can also make people forgetful. So if you are having some of these symptoms, it's definitely worth talking to someone, and your GP might be the first person to talk to about that, to do some investigation, maybe do a bit of a memory test, maybe do a brain scan even, to see what's going on, because there is help available, and it's really important to find out what's going on with you and get answers to questions if you're not feeling right. So those are my main sort of take-home messages for you today.
Oh, fantastic. Thank you so much. That was such a brilliant overview of sort of mental health in the ageing population and some sort of things that they can look out for, and really important messaging there for any of our viewers who may be approaching this stage of their life. So thank you so much. And I really loved the positives at the start as well. I think it's really important to frame each of these stages in our life as, a different chapter. So thank you so much for joining us today.
Great. Thank you.
Thank you for watching A Healthy State. I hope you found the information in this episode helpful. As always, this is intended to be general information, and if you have any specific questions about your health, please see a qualified health professional. This episode and the rest of the series is available to stream on CTV+. I'm Dr. Nelu Simmons, and I'll see you next time.